Good afternoon and welcome to Seminole County's press conference here on the COVID-19 updates. I'm Chairman of the Board of County Commissioners, Jay Zembower, on behalf of the County Commission here in Seminole County and our 7 cities. I want to welcome you to today's press conference. We're going to cover a lot of different things today. We've got a number of folks that are going to speak to you about some very specific things, and I'm glad that those folks have been able to make it here today, and I appreciate the media being here to help us get out the message today. First, I want to cover how things are being handled at the county level. Tomorrow we have a Board of County Commission meeting. This will be held virtually, very similar to last month's meeting. The meeting will begin at 11:30 a.m. will be aired on SGTV, Spectrum Channel 498, UVerse Channel 99, and Prism Channel 84. The meeting will also be streamed live on YouTube at the Seminole County Government channel, so tune into that. Anyone wishing to participate with public comment should register in advance. You can do that at seminolecountyfl.gov/BCC. If you're having any difficulties or you cannot find that, simply pick up the phone and dial 407-665-0808. You'll get some assistance on how to get in there and get you hooked up for any participation you want to do from the public. We also have helpful hints that you can review for doing meetings virtually. I know a lot of people today, whether it's with your business or your family, you're doing virtual meetings either through FaceTime or Zoom and many of the other applications out there. We will also have a closed client attorney meeting, which will occur, and the board will reconvene at 1:30 tomorrow afternoon. Public hearings will follow the consent agenda. Let's now talk about reopening Seminole County and what's going on there. We have an executive policy group that has met 3 times recently and talking about reopening Seminole County and what that might look like. The group is comprised of the county attorney, the county chairman, county manager, deputy county manager for economic development, deputy county manager for operations, the fire chief of Seminole County, as well as our health department, health officer, Florida Department of Health, our medical director, and the sheriff of the county. We're continuing in contact with all 7 cities' mayors and their managers so everybody understands and collaborates on what this may look like when we get back to start opening. And of course, we're waiting on Governor DeSantis to give guidance from the state level. Once we have that, then we'll be ready to get our stuff up to speed and look and see what Seminole County looks like. With that said, we're also working with Orange, Osceola, and Lake County and our surrounding counties. We will have a teleconference on Thursday to further discuss what things look like before the executive order that's currently in place expires, or discuss anything that the governor may send out with reopening the state. Finally, business leaders have also provided much of their input through us. Seminole County is continuing to develop and fine-tune the plan using the best statistical data available to our teams. We're utilizing all the medical and economic data, and we will be driven by the data on a day-to-day basis. The county is standing by and waiting for the governor of the state of Florida to make his orders. Once we receive this information, we'll be ready to act quickly. What I would ask our business people to do, we don't know what this is going to look like to reopen. We do know that it's going to be a stepped approach. It's going to be slow. If you listened to the governor earlier today, you heard him say that for the most part, the entire state, including those southern counties, are actually meet the federal gating requirements that the President's task force has put out. So with that said, we're simply just waiting for the governor to make his declaration, give the guidance. I would ask our business community to start looking at what distancing looks like for your business. You know, everybody's business is different, whether you're in retail, whether you're in manufacturing, whether you're in a service providing environment. You would probably be well served to look at what keeping 6-foot distance from your patrons as well as your employees and what that may look like once things get reopened. As we know from the President's task force, the social distancing is going to be a big portion of all guidelines, so you would be well served to look at those and see how that fits into your environment. With that said, we're going to have Alan Harris come up here from Emergency Management and give us an update, as well as Donna Walsh from the Health Department. And we have Alex Castro, President of Nonprofit Provider from Allied Health. Allied Health is administering and processing the tests at the Altamont Mall site today, and we appreciate that very much. Alan, thank you.
Thank you, Chairman. Alan Harris again, Emergency Manager for Seminole County. I want to thank you all again for being here. We're still, of course, active in the EOC, and we will remain active in the EOC. Even if we start to go to different phases of reopening, we still have individuals that are in their homes that are isolated and quarantined. We still have folks that are positive inside of the homes. And of course, we are still trying to take care of those individuals. Our Citizens Information Hotline will remain open. So as far as operations, we will remain consistent. Our Citizens Information line to date has taken over 6,500 calls from individuals that just want general information about COVID-19, where they can get a test, government closures, what things are open or closed. So they've done an incredible amount of work. That number is 407-665-0000. Again, 407-665-0000. And that is staffed by Florida Department of Health and Seminole County Emergency Management personnel. Our website also has a lot of great information on it. It's been hit over 327,000 times since the onset of COVID-19. We have a specific page just for COVID-19 response off of our preparedness website, prepareseminole.org. So 327,000 hits, and we appreciate people going there to get information. I'm extremely excited today to announce the opening of yet another drive-through test site here in Seminole County. So now we have 2 drive-through test sites and a pop-up site in the county. So the newest site is at the Altamont Mall. We've had a steady flow all day long at the Altamont Mall. So far, 101 individuals have been tested there, and we have appointments booked throughout the rest of the day, expecting around 250 tests to be done at that site. The pop-up site at Bookertown is also working very hard today. They have done 175 tests at the last report, and they continue to do great work on the northwest quadrant of the county. They are doing that at the Bookertown Community Center. We also have plans to go to Georgetown, Jamestown, and Lincoln Heights, and we are looking at opening a couple other sites next week. These neighborhood-based pop-up sites are for low-income and individuals which may have problems with transportation, problems getting to the testing sites. So that's why these pop-up sites have been developed. Last week alone at these pop-up sites, we had 874 people tested. So that's a lot of individuals that were tested just at the pop-up sites. So clearly there was a need in the community for that service. We want to thank True Health, our nonprofit partner, which is out doing great work there. We invited someone to come here from True Health, but they are so committed to getting those tests done in the Bookertown community. They said, can we go to the next press conference? And we're going to get them on one of the next press conferences. Of course, they've been here before, but they are truly committed to those individuals and those neighborhoods and making sure that those tests are being done. For the Altamont Mall site, which will, of course, which will take place all the way until Saturday, we only have 2 appointments remaining. So we are looking at extending that drive-through site in the Altamont Mall into next week. And of course, the Seminole Town Center Mall by Advent Health is continuing to function effectively and efficiently today, and appointments are required and available for that site as well. We have had a lot of questions about antibody testing. So we have heard now that LabCorp and Quest can do antibody testing. There are press releases related to that. You would need to go to your private physician's office to get a prescription, and then you can go to LabCorp or Quest, whichever your provider seeks or goes to get the test. There are a couple urgent care and private medical facilities. The Urgent Care Center of Longwood is also doing antibody testing. So you can go to that site. You do need to make a reservation prior to. So you do need to make an appointment prior to going there. Those are the only antibody testings that we know of in Seminole County at this time, but we are calling each day all the urgent care centers and the private physicians to get a good list. And of course, that will be available on the website at prepareseminole.org. We have had a few assisted living facilities and nursing homes that have had COVID-19 individuals inside of those facilities. There are 10 facilities in the county, which the Emergency Management Office and the Florida Department of Health, as well as an incident management team developed of regional and state emergency managers and health department personnel, which are going into those facilities to make sure that proper personal protective equipment is being worn, infectious disease control measures are taking place, and the training, additional training to staff. Infectious disease measures have been instituted in all of those facilities, and protective measures are being taken to prevent the spread of the disease anywhere in those facilities. Those facilities have also received an enhanced personal protective equipment, so additional personal protective including N95 masks, gowns, and booties for the healthcare workers that are working in those facilities. Along with that, of course, we have continued to provide personal protective equipment to assisted living facilities and nursing homes and hospitals that also don't have COVID-19 patients in there to protect our healthcare workers. So far, the state and federal government have been able to send us quite a bit of N95 and surgical masks. We are extremely happy about that. Gloves and the booties that we've been able to get out to the ALF, nursing homes, and hospitals. Unfortunately, gowns continue to be an issue, and we are working with private vendors and also the state to request additional gowns so that our healthcare workers can be protected. The intelligence unit at the EOC continues to call all positive monitoring and PUI patients. We have been providing, of course, food and other types of services to those individuals. We want to thank the Foundation for Seminole County Public Schools, as some of these requests that have come into the EOC from individuals that have COVID-19 or family members that have COVID-19 have school-age children and they need school supplies. So we've been able to provide some school supplies through that partnership with the Foundation for those individuals that are isolated and quarantined in their home. Of course, we are also providing food, water services if they need water. There's a boil water notice in the neighborhood, or other types of services like medical and pet care. We have not required the use of masks in the county for every person, no matter what they do, but we certainly are suggesting that whenever we leave the building, we wear masks, and there's lots of different masks that you can get. The personal protective masks, like the N95s I was speaking of, is really for our healthcare workers, but there are cloth masks that you can get. I got one of these. You can get them for your favorite team, but I wear this every time that I leave the building. It's reusable. You can wash them, and we will have information on different types of cloth masks that can be worn on our website and through our social media later this week. We definitely encourage it. Again, we did not issue an order or require it, but it's certainly highly recommended if you go out in the public and are interacting with anyone at all in a store or wherever to wear a mask, absolutely. With that, I'd like to turn it over to Donna Walsh, our health officer.
Thank you so much, Alan, and good afternoon, everyone. Just want to brief you on the current data that we have available through our Florida Department of Health dashboard. As you see here, I know I presented this last week at the press conference. The bottom here is what's accessible to everyone. It's public information, and this can be found at floridahealthcovid19.gov. As of over the weekend, we can now pull separate reports for individual counties. So if you go to that website, you can pull down specific graphs and charts for Seminole County specifically. Just wanted to indicate here, to your left is the state reporting here of the lab dates of lab reported, and you'll see that the curve is going down with the number of cases reported per day. This is Seminole County here. And so same thing, you know, we do discuss, or we keep talking about flattening the curve, and this is what it looks like to flatten the curve. This shows that the number of positive cases being reported, although our testing is increasing, the number of positive cases are still declining, which is good news for our community. This top graph is a difference between the number of labs reported, which is the orange line here. The blue line on the bottom is the date that people became sick. So, you know, as folks are reported positive for COVID-19, we ask questions as when was your date of onset of illness? And so you'll see, because there is a delay sometimes in lab reporting, it could be upwards of 14 days sometimes, depending on the volume of tests being performed at the individual labs. We like to look at the onset date of symptoms to give us a better picture, the blue line, if you will. And again, you'll see a significant flattening of curve of both onset date of symptoms of cases as well as date of the lab report. So to date, Florida's had a total of, as you can see here, 32,138 positive cases with 1,088 deaths. In Seminole County, we have 367 confirmed cases, 361 in Seminole County residents and 6 in non-Seminole County residents. It's sad to report that we have 3 additional deaths since the last time we spoke, last Monday at the press conference. Our deaths are in white, Hispanic, males and females. And so, you know, again, our hearts goes out to the families who have lost loved ones to this virus. Most of our cases are in women, 53% women, 47% men. And in looking at health disparities, as I've reported before, the cases that are being reported positive to us thus far consist of 12% African American or Black, and 71% white, 36% Hispanic. So the demographics for Seminole County include normally 12% African Americans. However, our Hispanic population makes up 22% of the county, and so we are seeing a disparity in Hispanic population still. There have been a total of 80 hospitalizations of residents in Seminole County to date since we started learning of cases in our community. 15 folks are currently hospitalized. To put things into perspective, as Mr. Harris was talking there, last week when we met, we had reported 4,239 tests that were performed here in Seminole County. As of this morning, there's reports of 6,327 tests now that have been performed in our community. So the pop-up testing definitely is an indicator, the people participating, that we certainly have a need. And we will continue to look at that need elsewhere in the community, whether it be through nonprofit organizations, faith-based organizations, or such, but we will definitely continue to look at that and see where else we can provide testing to meet the needs of our community. We are also, looking at the positivity rate here. We have for a while been hovering around 8.4% of all the tests performed turning positive, but as of this morning, we're now at a 5.8% positivity rate. So that is a good sign as well, is of all the folks that we're testing, the majority seem to be negative so far. That helps us to understand the spread of disease in our community and help us as we make those plans to reopen our facilities. So that's a very important marker. Also wanted to let you know, there's questions sometimes as to, well, how many people have we monitored over time? As Alan was saying, the county has been extremely supportive of social services of folks that we've asked to isolate or quarantine. If somebody is infected with the virus, we ask them to isolate at home during the period of time that they may be infectious. If they are in contact with someone who's positive, then we ask them to quarantine. And then if somebody has symptoms but their test results may be pending, we also ask them to isolate. So overall, we have been monitoring over 1,000 people since the beginning of this event. And to date, we have about 230 people that we're monitoring currently, and that includes cases, contacts to cases, and those folks who are symptomatic but awaiting test results. The CDC, the Centers for Disease Control and Prevention, just opened up the case definition, or symptoms, if you will, for people to get tested. So before, it's been fever, cough, shortness of breath, or difficulty breathing. They've also now included, because they've learned more about this disease and what other symptoms people are having that have tested positive. So if you have additional symptoms of chills, shaking, muscle pain, headache, sore throat, or a loss of taste or smell, you would definitely qualify under the CDC criteria to be tested. A number of our pop-up test sites, however, we are not requiring that you exhibit any of those symptoms, because essentially, if you're asymptomatic, you may be tested at some of those pop-up sites, the majority of them, because we know that it's spread in our community and people may be exposed and just not realize it. So that's one of the reasons why we are opening up to everyone. We certainly encourage you, if you have any signs or symptoms of difficulty breathing, shortness of breath, or persistent pain in your chest, please seek medical attention immediately. Please do not wait. As I said, we're learning more about this virus, and some people become sick very quickly. So please do not wait. Please either call 911 or go to the hospital emergency department for evaluation and treatment. The health department also has a call line for people with questions. So that is 407-665-3000. And our state call center is open 24 hours a day in the event that you call after hours and would like some questions answered. And that is 1-866-779-6121. I want to thank our community for adhering to the guidance that's been put forth to keep this disease from spreading, and you are saving lives. I thank you so much for your compliance and adherence. I ask that you stay vigilant, that you stay patient as we move through these different phases, and let's protect everyone's health and safety together. Thank you so much. I would like to introduce next Allied Health, a representative from Allied Health. They just arrived here a few moments ago to speak about the pop-up testing center at Altamont Mall. Thank you.
Thank you and good afternoon. I'm Dr. Evans, Alex Evans. This is Ivan Hippolyte and Alex. How are you? So first of all, I want to thank everyone for the opportunity to come up. When I heard about Allied Health and what they were doing in the South and Miami area, I got on the horn and called up Mr. Hippolyte and said, is there a possibility that we can do more work here? I am a local physician in Seminole County. I'm a trauma surgeon, and I am very engraved and concerned about my community. And there so being, I wanted to make sure that we are providing the best care, the best health care, the best testing, and best preventative health that we can in our own community. So that's why I was concerned with about the amount of testing that was going on, and I reached out to this organization and brought them up here. I really thank you guys for the opportunity. I think that we're doing really good work here. We started today at the Altamont Mall area as one of the pop-up testing sites, and I think thus far we've tested almost 200 people, close to it. It is by appointment, but I do encourage people to call in and try to get on that list. We'll be here at least through this week and hopefully further on. If there were any specific questions, I'd love to take them, but I would like Alex mentioned a couple of things, maybe Ivan, as we're up here about the company.
I'd like to thank everyone for having us up here as well, especially the emergency management team. They're excellent, great setup, great organization, and the police department as well. It's an orderly flow. Everyone's coming in with their appointments. It takes about 7 to 10 minutes to get through the line. We get all their information. We swab them, we process the information, and they should have the results, I would say, maybe 48 hours.
Yeah, pretty much summed it up. All right, so once again, thank you so much for allowing us to come up and allowing us to do help to this community.
Muy buenas tardes a todos. Ahora un resumen de todo lo que ha acontecido en español. Primeramente, el presidente de la Junta del Condado de Seminole, Jay Zembower, está avisando donde mañana se va a continuar las reuniones de la Junta de Gobierno del Condado de Seminole. Lo van a hacer a través de Zoom y va a ser virtual. Empieza a las 11 de la mañana. Lo podrás ver por los canales de SGTV, el canal de Uverse, canal 99, Prism, canal 84, y también se va a estar por YouTube y por la página del gobierno de Seminole. Pueden ir a la página de seminolecountyfl.gov/BCC para poder registrarse a través de Zoom. Para aquellas personas también que quieran hacer comentarios en la junta la reunión de la Junta de Gobierno. La Junta también, la de reabrir el gobierno, se han reunido ya 3 veces y las personas que están en esta Junta, que están ayudando, son el administrador de la Oficina de Manejo de Emergencia, el abogado del condado, el presidente del condado, el administrador del condado, el asistente administrador del condado también, el oficial de bomberos, también la oficial del Departamento de Salud, el sheriff del condado, y entonces con ayuda de las ciudades, de las 7 ciudades del condado de Seminole, quieren hacer claro que se va a reabrir esto por etapas. No va a ser algo que va a ser de momento, de improviso, va a ser lentamente y va a ser por etapas. Se va a seguir haciendo los distanciamientos sociales que hemos estado haciendo por el pasado mes. También se va a ver y reunirse con los oficiales de lo que venga de la oficina del gobernador y del estado para las recomendaciones para abrir el condado. El jueves se van a reunir con oficiales de todos los condados también, porque las órdenes de ejecutivas están a expirarse y van a determinar si se van a continuar o si van a hacer algunos cambios. Esos vendrán de aquí al jueves. El director de emergencia, de manejo de emergencia del condado también, Allen Harris, dio un resumen de lo que se está haciendo en su oficina. Actualmente, desde marzo 13, han tomado 6.500 llamadas telefónicas en la línea de ayuda. Esa línea de ayuda es el 407-665-0000. Y también tienen personal en español por si necesita hablar con alguien. También han habido 327,000 unidades de toque por la página de prepareseminole.org. También en la página de prepareseminole.org hay un enlace que dice en español. Puede ir a ese enlace en español para toda la información que tienen en español. Se han abierto hoy un nuevo sistema de prueba, un sitio de prueba en el mall de Altamonte, donde pueden ir a hacerse pruebas de coronavirus, de COVID-19. Además del que existe en el Seminole Town Center. Hoy en el del Altamonte Mall se han habido 250 pruebas. En el pop-out site de Bookertown, también en el centro comunitario de Bookertown, se han hecho 175 pruebas. Desde la semana pasada han habido 874 pruebas que se han hecho a las personas. El de Altamonte Mall es por cita, puede ir personalmente, pero prefieren por cita. Van a estar ahí abiertos toda esta semana, posiblemente extiendan la semana que viene. Actualmente solamente quedan 2 citas por hacer para el Altamonte Mall. También en el condado se está empezando a hacer pruebas de anticuerpos. LabCorp y Quest están haciendo estas pruebas. Pueden ir a hacer una cita con ellos, pero sí necesitan un referido de tu médico. También en el Urgent Care de Longwood se están haciendo la prueba de anticuerpos y también es por cita. Verifique con esta agencia para ver si pueden hacerlo ahí. Se están manteniendo contacto con los centros de emergencia que existen en el condado de Seminole para asegurar que los residentes están bien y si necesitan más equipos y que se sigan distribuyendo equipos de protección en estos sitios. Actualmente en el condado de Seminole están sugiriendo el uso de máscara cuando salgan afuera, pero no es requerido que lo tengan que hacer, pero se le está sugiriendo que sí se proteja a usted y a otro. La oficial del Departamento de Salud, Donna Walsh, también estuvo con nosotros y proveyendo los datos que están viniendo del estado. Actualmente está enseñando en el estado de la Florida 32,138 casos positivos, en el condado de Seminole 361 y han habido 8 muertes en el condado de Seminole. De estos 361 en el condado de Seminole, 128 son hispanos que han dado positivo y son el 36% de todos los que están positivos. Desde que se comenzó, 80 han habido hospitalizados en total. En el condado se han realizado 6.327 pruebas en el condado y actualmente el porciento de positivos ha disminuido al 5.8% y sigue bajando. Esto es bueno de que se siga bajando este número. Se le está pidiendo, si está infectado, quédese en su casa, no salga, y si salió positivo, quédese en su casa. Si está experimentando síntomas, puede llamar al Departamento de Salud, llame a su médico para que le explique. Los síntomas se han expandido por el departamento, por el CDC, donde ahora incluye muchas más cosas, además de la tos y la fiebre que se experimenta. Si quieren más información, pueden llamar al 407-665-3000. También le damos las gracias a Allied Health, que están ahora haciendo las pruebas en el mall de Altamonte y seguirán haciéndolo por lo menos esta semana y posiblemente la semana que viene. Están procesando el proceso ordenado, prefieren por cita, pero pueden ir sin cita. Dicen que se está tomando alrededor de algunos 7 a 10 minutos en hacerse la prueba con resultados en 48 horas. Para más información puede visitar a la página de prepareseminole.org y en español puede el botón del enlace en español y seguiremos reportando. Muchas gracias.
Thank you, Mr. Cortez. We appreciate sincerely you coming in and doing the Spanish version of the press conference on behalf of our community. Thank you very much, and as well as your legislative days in Tallahassee on behalf of the folks here in Seminole County. Again, I want to thank everybody on behalf of the Board of County Commission, the 7 cities. We also want to thank the school board, who has been doing an excellent job of keeping our children educated during this shutdown that's occurred and will be out for the rest of the year. We appreciate those parents and business owners and all of our citizens who've truly done what's right to bring this COVID-19 down to a much reduced level we're seeing with this uptick in testing. And again, we appreciate everybody being here today. Thank you on behalf of the whole team here at the Emergency Management Center. And let's remember not to forget the first responders who are diligently looking after the community, as well as all those folks in our healthcare facilities who are making those sacrifices so that we all remain safe. So with that said, we'll open it up for any questions that you all may have.
Jay, when talking about reopening the county, you said you're working with other counties. Sort of explain that process and why it's important to work with the other counties.
Yeah, sure. So the question is, working with the other counties. So yes, we're working with Orange, Osceola, Lake, and of course Seminole. And it's important because we're all pretty much on the I-4 corridor. In the I-4 corridor, we have a lot of movement in that area for people going to work in Orange County, people from Orange County coming to work in Seminole County, as well as Osceola and Lake. So with that understanding, it's important that we all continue to have collaborative conversations on what is happening in the entire region. Now, at the end of the day, there may be some nuances or differences to what each area decides to ultimately do, again, pending Governor DeSantis' update on what he's going to give us here to work with. But it's important that we understand what each county is doing and respect that, because the last thing we want to do is offset some imbalance significantly where one county is now going across county lines unnecessarily to either perform business or travel unnecessarily. So we continue to meet with them. I think our next press conference or our teleconference is this Thursday, which is just on the advance of the expiration of the state order. So we'll be discussing whatever orders have come out by then, or if there has not been an order, I suspect we'll be having some very candid conversation of what we do lacking any updates from the governor's order. But I suspect we'll have that before then.
We always are telling homeowners, when hurricane season's approaching, to how to prepare, make sure you get things ahead of the actual event.
Absolutely.
Plan for a fire evacuation plan before you have a fire. It kind of sounds like what they're telling businesses right now. At some point, reopening of the economy, if you will, is going to include social distancing. Your suggestion that right now they have a meeting among themselves how can they conform with that?
Sure.
Takeout only was one thing, but when there's some morphosis of
Right.
reduced occupancy, how's that gonna look?
Yeah, absolutely, and that's the point. You know, we know what the CDC guidelines are, we know what the President's task force is, we know what the gating and the 3 phases are, and we've got chambers of commerce here in Central Florida that are working with the local businesses, and as well, you can call our EOC for any assistance or guidance, but the bottom line is, you should be looking for best practice for your specific type of operation. Service businesses will be one thing. If you're a manufacturing facility where you have maybe an assembly line of workers of maybe 20 or 30, setting up or thinking about how you move those workers 6 feet apart. Now would be the time to do that instead of waiting until the ultimate time when an executive order comes out and you're scrambling around trying to figure out how you do it. A lot of businesses are already doing that. You know, leading up to this, fortunately here in Seminole County, we had some segment of that already that businesses were trying to fit into. And of course, just like some of the box stores are doing already. They're limiting their capacity, knowing they can try to keep people 6 feet apart and doing those signages and so forth throughout their operations.
And for service people, plumbers, electricians, air conditioning, that may have to go into someone's own pest control.
That's right.
Do they start thinking about laying in PPE that takes them through October?
Yeah, I think that, you know, anybody that comes in contact with the public in those kind of settings would be well served to wear face protection. Again, the N95 respirators and so forth, we want to try to preserve for first responders, healthcare people. But, you know, as Alan Harris illustrated, there are plenty of other type masks that you can get. Some are homemade, some are just cloth-based, a scarf type setting to help protect you and others from those type of services, absolutely.
Another question maybe for Alan or Donna regarding first responders and PPE. And I know the CDC, their guidelines state that if they come in contact with somebody that is positive at one point, they have the option to remain on the job, but if they're not showing symptoms, asymptomatic, should those people be responding to calls and stuff until they're released from?
Sure. So any response that we have that the individual is a potential COVID-19 positive patient or a COVID-19 positive patient, we get information from the epidemiologist from the Florida Department of Health. Verification of PPE, appropriate PPE, is made for those first responders. And if for some reason that did not take place, and that only happened once, and I would say that was at the very, very, very beginning of this whole event. In that case, and it was a single case, that particular unit was isolated and quarantined for 14 days. They've come off of that, of course. For every single other run that we've done, appropriate personal protective equipment was worn. Our 911 system at the very, very beginning started to ask specific questions. And those questions were to alert the ambulance and the fire engine as they were responding to the incident to let the paramedics and the firefighters know once they get there, they needed to make sure that they donned the appropriate personal protective equipment. And to date, so far, we haven't had any COVID-19 positive individual firefighters or paramedics or EMTs. We've been very blessed. Other departments around us have, but we have not. And except for that one group, they haven't had to isolate and quarantine.
So people should not be concerned if a police officer or a deputy or a paramedic or firefighter that had been exposed shows up, even if they're fully dressed in the proper PPE?
If they've been exposed, then that means, and they're still on the job, that means they wore the appropriate personal protective equipment, that they wore the N95 mask, the gowns, a nurse would wear dealing with a COVID patient every single day. So the same equipment, same personal protective equipment is worn by the paramedic, is worn by the EMT. So yes, they would still be able to come do their job because they were wearing the appropriate equipment.
Ellen, I'd like to quickly for you to respond to it. We're starting to get some really inquiries from the public. You know, when this all started, some of the estimates were just horrifying and enormous, and we're not seeing that. Could you put in perspective about that it wasn't that the people who were in charge, like yourself and others, were exaggerating the threat, that really it's because the right things were done to try to reduce the threat?
Sure, and I I don't know if you want to comment on that, but I'm looking to our trauma surgeon as well. But yes, I mean, obviously, the statistics, the information we were getting from medical doctors at HCA Hospital, at Advent, and Orlando Health was that this could have been a very, very bad event. It can still be a very, very bad again. They've been talking about this second wave. And the second wave isn't a joke. The second wave is a reality. If we do the proper things, I think that we have seen this leveling off because people are social distancing, because people are staying at home. But don't just take it from an emergency manager, take it from a medical doctor. That's who we really need to hear from. So thank you, Alex. I appreciate that.
Don't walk away.
Doctor. I want to make it
Yeah.
is that there are some people that are skeptical, and they're being skeptical of the fact that they didn't see these horrible numbers, but those horrible numbers were prevented rather than some kind of figment of somebody's imagination.
Right. Again, Alex Evans, I'm a trauma surgeon here in the community, but I wanted to emphasize that part of what has gone on is the social or the environment around us. People have actually adhered to what we wanted to happen. It was severe to many portions of our country, actually, as far as what we had to do. But we saw what could happen in New York. We saw what could happen in other states. So it's not something to play with. It's definitely a serious issue. And that's why I think the biggest issue that we had was testing. And that's why I was so adamant about getting testing in our community and beyond, because of that. It's so important. But yes, by us now seeing it, yes, people got afraid, and rightly so. They social distance. I see in the community now, even though we don't have an order, people are putting masks on their face and they're going into the community and they're being serious about it. Once you become serious about it, yeah, things are going to change. So, you know, don't poo-poo what has happened. This is the right thing to have happened, not the wrong thing. That's all. Thank you.
Since we've been doing the community pop-up sites, we talked last week about maybe seeing a surge in some of those communities. Have you seen a surge, and if not, are you satisfied that maybe it's not as bad as maybe you might have thought, or?
So we have seen a very small increase in the positive cases. The percentage, Donna spoke about it, but the percentage of individuals that were coming back positive has decreased. So what does that mean? Does that mean that those people weren't at risk before? No. What does it mean that those people, it means that the people isolated and quarantined in their homes. It means that people did social distancing. I know when I go home, I stay at home. The only time I go out is maybe to the grocery store, or if something breaks in the house, I'll go to the hardware store. Other than that, I don't go very many places. We're seeing that. We're seeing that throughout the community. Well, it's very hard for a virus to spread if people aren't going out and spreading the virus. So that's what we're seeing, and that's the results we're seeing. And now the tests are changing. But you can ask the guys from Allied Health that, you know, the testing 3 weeks ago, the percentages were incredible, but the percentages today are decreasing. In fact, when we opened up today, we were talking about hopefully these test results will come back with a lower percentage. But do we still test? Yes, we still test, because we need that data. We need people to still go out and get a test. We need to figure out what's going on in our community. This is a brand new virus. We've never experienced it before. So we need to know what's going on in the community so we can make, so, you know, the chairman, the commissioners, they can make the appropriate decisions. If we have no visibility on what's going on there, if we have no percentage of what's coming back, we don't know where we are. So it's a good thing, all in all.
I have another question
Sure.
about the test sites. Are the test sites that we've opened up at Allied Health, with Allied Health, and also at the Seminole Town Center Mall and the community sites, are they specific to Seminole County residents, or can anyone come?
Anyone can come to our three the two drive-up sites. The pop-up sites in the neighborhoods, we are really focusing on the low income, the individuals in that neighborhood and surrounding areas, people with transportation disadvantaged. That's the purpose of those neighborhood-based. Can someone come into the neighborhood and get tested? Absolutely. We haven't turned a single person away, but that's what the focus of that particular thing is. All right, thank you all very much.
Again, thank you all for attending today. Also, just make a note of prepareseminole.org and the phone number for citizens hotline 407-665-0000. Also, not to be remiss, this is not only about being healthy and being safe, but to make sure that the community feels safe. And that's going to be a big issue about people getting back to work. You may be safe, but if you don't feel safe, you're not going to want to leave your house. So, part of our goal is to make sure that whatever testing, whatever healthcare providers give us, and you business owners and operators need to know, you need to be doing everything that once things open up, to do the necessary steps to make sure your patrons feel safe. With that, thank you and God bless and be safe.